Thanks for joining us today. I'm Brandy. I'm Clinical Program Coordinator at Scottish Rite Hospital, and I'm here with Dr. Shane Miller to talk about sports-related concussions. Dr. Miller is our sports medicine physician and an associate professor at UT Southwestern in the departments of orthopedic surgery and pediatrics. Thanks for joining us today.
Thank you, Brandy.
Yes. Can you start with telling us a little bit about your practice and treating sports-related concussions in young athletes?
Sure. I'm a primary care sports medicine physician, which means I'm a pediatrician that specializes in sports-related injuries and conditions. And the majority of my practice is in the clinical setting, taking care of patients who've had injuries, but I also spend a lot of time as a team physician on the sidelines, covering games. And so I experience concussions both as they occur in the field of play, but also days to weeks to sometimes months after the actual injuries occurred. We take care of hundreds of patients who have suffered concussions per year in our sports medicine clinic here at Scottish Rite.
Okay. For viewers that don't know much about concussions, how about you give us a basic definition of what is a concussion?
That's good. A concussion is a brain injury that's caused by a blow to the head or a blow to the body that causes the brain to shake inside of the skull. This shaking causes problems with the brain, that the brain is functioning, and can cause a lot of different symptoms, including headache being the most common symptom. It can cause memory problems, difficulty concentrating, light and noise sensitivity. We break them down oftentimes into symptoms that cause pain or sleep issues or mood issues, as well as issues with the way that we think, so cognitive problems.
Thanks. Well, we've gotten a lot of great feedback about your practice here at Scottish Rite, but we've also gotten some questions that we can get started with today. And Elizabeth asked us one and said, as a parent, what signs should I look for, and how will I know if my kid needs to be pulled from the game for a concussion?
So, I think that sometimes it's fairly obvious when a child has had an injury that they need to come out, and everybody in the stands and everybody that's on the field is aware that child's been hurt. But the hard ones are the ones where there's been a blow and the kid maybe seems a little bit stunned or dazed is a word I often hear, a little bit slow to get up, maybe they clutch their head, but if they start complaining about any symptoms, headaches, dizziness, not really remembering what happened, but I think that those are the biggest ones, headaches and dizziness that we hear most commonly. Even if the child's not complaining about symptoms, if somebody sees that child is acting differently or not responding appropriately or seems like they were a little bit slow or wobbly getting up or after the injury or the blow to their head, we say when in doubt, sit them out and keep them out. Sometimes these symptoms don't show up right away, and it takes hours and minutes to hours to where I commonly will hear that they felt fine while they were out there during the practice or the game. They kept playing, and then afterwards, then their symptoms really worsened either that evening or the next day when they went to school. So again, when in doubt, sit them out and keep them out, because we don't really know what's going to happen with this injury. So I'd rather you hold them out, make sure they're fine, and then let them go back the next day than to let them continue to play. Continuing to play after having the injury puts them at risk for a worse injury as well as a prolonged recovery. So we find that if they kept playing and didn't come out at the time of their injury, they're going to take longer to get better. Ultimately, they're going to miss more school, and it's going to take them longer to get back, and so they feel worse.
She wants to know also if she should take them to the emergency room or the pediatrician when she suspects a concussion.
That's a good question. It depends on it depends on the symptoms that the patient's exhibiting. The vast majority of these do not need to be seen in the emergency department and can be observed at home and then evaluated by the pediatrician or the primary care physician the next day. But there are some cases where the injury is more severe and they may need to go to the emergency room for imaging to make sure there's not a brain bleed or something along those lines. But if they're not having severe vomiting, difficulty talking, slurring of their speech, if they're very, very tired and can't wake them up, or if they have a severe headache, those kinds of things you want to take them to the emergency room for. But otherwise, most of them don't have to be seen in the emergency department.
Okay. And Beth asked us how we feel about using MRIs. Should we use that to diagnose, or are you using it to return a player to playing?
I think in the past, people often would order a CAT scan, especially in the first 24 to 48 hours in the emergency department, to look to see if there's been a crack in the skull or a skull fracture or a brain bleed. And those are helpful for determining those types of injuries, but a CAT scan does not show us if there's been a concussion. And so due to the risk of radiation and the concerns about high doses of radiation, I think we try to avoid doing a CAT scan unless we need to look for those other things. An MRI shows us better the structure of the brain, but doesn't really diagnose a concussion, so to speak. Newer technology, such as what we call DTI, and there are other forms of MRI that are coming out that are giving us a little bit of different window into the brain and the way that the brain works and the structure of the brain and the function of the brain, which I think are promising technologies that in the future may be able to use clinically more to help us understand the injury as well as to make some return to play decisions. But right now, these are essentially being used in a research type setting, and so our technology is maybe a little bit ahead of our understanding of what to do with that information.
Okay. Mary Jane just asked us a question: if you are more likely to have a concussion after you've had one.
It's a good question. The answer is yes, especially in the first 2 to 3 weeks after the initial injury. And part of that is because while the brain is actually injured, it's more at risk and it's sort of fragile, so to speak. It's more at risk of having another injury. And so that's one of the reasons we say when in doubt, sit them out and keep them out, is because if they were to go back and to sustain a second blow to their head while they're still recovering from that first injury, the results of that can be devastating. And so there's the concept of what is known as second impact syndrome. And what that is again, taking a second blow to the head while the brain is still recovering from that first injury. And the theory is that the brain will then swell, which can cause very serious problems, including death. And while that's a rare occurrence, it only occurs in sort of young athletes, and it's something that we obviously would never want to have happen to any of our children. But it's one of those things that we just really are cautious about them not going back. As far as risk down the road, that risk will remain elevated, but we're not sure if that's because of now that they've had the injury, is their brain more fragile, or maybe they were more at risk to start with, or perhaps they're just going to go back to doing the same things that they were doing that caused their injury in the first place. If you got hurt playing soccer, you're going to go back to playing soccer, and soccer puts you at risk for concussion. So the answer is whether it's genetics or whether it's because of the injury or whether it's because of the activities they're doing, yes, that risk is elevated after you've had a concussion.
Should a high school student do schoolwork when suffering concussion symptoms like headaches? Janie was asking that.
Okay. School is a big thing. In terms of adults, we have jobs and life and family and things that that's our jobs. But for kids, their job is school. Whereas most of them would like to think that their job is playing football or playing baseball, but that's not their priority. Their priority is school. And so they are student athletes. So I focus a lot on what we call return to learn, which means getting them back into school. But we do it based on their symptoms and what they can tolerate. So in the past, I think that we were pulling students out of school completely and saying, stay home until you're not having any symptoms at all anymore. But we find that they fall behind, and then they're stressed about missing their tests and their homework, and then now you're dealing with that, and then they have a lot of makeup work. And so we let them do what they can tolerate. So if they feel about 50% of normal, they can probably do about 50% of their normal course load, but they shouldn't be expected to do 100% of their normal coursework, or that's going to worsen their symptoms and prolong their recovery. So we work very closely with their teachers and with the school to try to help develop a return to learn program, which we individualize to the patient and the athlete is based on where they are, what tests they have coming up, what periods they have in the day, what makes their symptoms worse, and based on what their exam is like, what kinds of extreme symptoms they're experiencing, we can individualize their plan so that they can hopefully get back into school as tolerated.
Very good, very good. So we've got, let's see, here's one from Laura. What's your recommendation for lingering symptoms? Do symptoms get better and then reappear worse later?
The majority of young athletes will recover fully from their concussion within 3 to 4 weeks. About 80% or so of patients will recover fully. So that means that some, 10 or 20% of patients will continue to have lingering symptoms and symptoms that will last longer than a month. So I think part of the goal is for us to identify what are those symptoms and what may be causing them, because sometimes early on, we're focused on the brain, but it may be perhaps they had a whiplash injury and their neck is actually causing some of these symptoms. And so if we just keep thinking this is all coming from the brain, but we never treat their neck problem, then they're going to continue having those symptoms. So that's where an evaluation by somebody who has a little bit of experience in evaluating patients we can kind of try to figure out what is causing those symptoms. And sometimes these are very difficult to treat, and it takes a multidisciplinary team. And so we have psychologists on our staff, we have physical therapists on our staff. We work with a lot of our other specialties as physicians, whether that's neurologists or neuropsychologists. We work together to try to figure out exactly what's going on, and we treat that, and again, individualizing it to the patient. But it can be devastating to a family when they continue having problems months after their injury.
Okay. We've had a couple of questions about equipment. What's the best helmet? Do the headbands that absorb vibration that we can get online work?
Yeah, I think that equipment is something that, again, new technology may help us down the future, but there's not really a concussion-proof helmet. There's not really one helmet that's going to, put your child at decreased risk. I say a properly fitting helmet is the most important thing, and a new helmet seems to be better than one that's been used and refurbished and or it's been passed down along the years. Some of the newer technology is a little bit better also than the older helmets. But really, proper technique, safe technique, playing fair and playing by the rules, making sure you're not lowering your head and not playing aggressively. I think those are big things that are risk factors that we can reduce and limit the risk of concussions. The soccer headbands and the headgear in soccer is an interesting one because there's been some studies in labs showing that it reduces the force of a blow, but we don't really know that translates to meaning a less risk of having an actual concussion. And so one of the concerns with wearing these headbands is that the athlete feels protected because they have this on there. Sort of like a football player who now has this hard helmet, they're more likely to lead with their head and hit because it doesn't hurt as much. So a soccer player who now is wearing a protective headband may put their head in places that they normally wouldn't have and be going in feeling protected, so making riskier plays, going for headers. So I think that a lot of times, again, teaching them to play smart, protecting themselves, keeping your head out of those situations. I would rather them stay back and take the ball off the rebound and then go after it, as opposed to 4 or 5 people trying to head the ball and putting their heads in, going for the same ball. We find that they close their eyes and they hit heads, and then that ends up leading to a lot of concussions. And so technology and new equipment, I think that there's a lot of research going into that. And the other thing is we see probably a couple or 3 times a month, I get questions about some new device or some new equipment that's come out and say, this is the latest, greatest, this is what's guaranteed to reduce your risk of concussions. And while it's nice and we are all hopeful that we can find those things, we have to rely on the research and the data to sort of show, do these work or not, because there's a lot of people making a lot of money on some of these devices without data to back them up. And same thing would go with medications and supplements to treat and prevent these injuries. And so we have to be a little bit cautious, especially in the sort of the academic world at the medical school, to really evaluate and practice what we call evidence-based medicine, meaning is there evidence to back this up and support these claims that these devices work. And so that's where we're looking at football helmets and other devices at our university as well as across the nation, trying to figure out how we can help these children.
So Karen asked a question, and one aspect of it might be tough for you to answer, but at what point is enough football enough, and other ways of seeing it today? Would you let your son play contact football? That's
good. That's a timely question since we just had a son who is 1 month old now. I think it's a great question, and part of that leads to the question of long-term risks of playing contact sports, collision sports like football, and is there a risk down the road of banging your head over and over again? I think most sensible people think it's a bad idea to bang your head against a wall over and over again, or to do something where you're going to hit that, right? We have a certain number of brain cells, and if you're going to knock off a few of them over time, eventually that may catch up with you. And that being said, sports I love sports. I think that there are so many benefits to children participating in sports. The exercise, the teamwork, the leadership, the self-esteem, the confidence. They have higher graduation rates. They do better. There's a lot of benefits that come with playing sports. And so my goal is to try to make sports safer so that our children continue to participate, rather than blaming the sports and pulling our children out and saying, we don't want you to play because you might get injured. I say, let's figure out how to make that sport safe so that our children can continue to participate. Okay, so I do think that it's very important for children to be taught proper technique. So if you're looking at some of our children that are 6 or 7 years old that are out there playing tackle football, they don't have the neck strength, they don't have the technique to have a helmet on their head. They look like a bobblehead doll out there, and they're out there running into each other. I don't think that that's probably the best decision for them. But we can start at that age learning how to technique and how to play these sports, so that by the time they have the strength and the ability to understand how to play, then we can incorporate some more of the hitting in. The American Academy of Pediatrics came out last year with a sort of position statement on tackling and tackle football in youth. And kind of weighed the pros and the cons and looked at that, and surprisingly, actually, they were not completely against tackle football, because there's a lot of benefits to that. So I think that we can really focus on proper technique, teaching children how to play safely. I'm a big fan of flag football, especially in younger ages, teaching them how to play the game, understand the rules of the games, footwork, hand-eye coordination, teamwork, all those benefits they can get. And then maybe once there's a coach who has been trained to coach, as opposed to somebody like me who may be a dad who is just teaching children how to play football because we enjoy it, we don't have that background of education and coaching that a certified coach might at the middle school or high school level.
All right, we got another question in. This is Carol asking, when should a patient see a specialist versus a pediatrician? Is there a length of time that symptoms persist that indicate they should see a specialist?
It depends on the comfort level of your PCP, I think. There are a lot of pediatricians in our area that are very comfortable at managing concussions and do an excellent job. And then I think there are some who would rather not manage them early on and would prefer that you see a specialist. And so I think talking to your pediatrician and knowing your relationship with that PCP, they're usually the ones that are going to help you know when you need to go see the specialist. So it's a good place to start with your PCP, and then if they're not comfortable that you're responding and healing the way that they would like for you to, then that's typically when they refer you on. Going back to that timeline, I think most patients will get better in that 3 to 4 weeks, and so if 2 or 3 weeks in they're not improving and showing the improvement we would like them to see, or if it's a more severe injury than we typically see, or perhaps this is a child who's had more than one concussion and there are questions about should this child go back to participating in that particular sport or other sports, or perhaps we're in the middle of the season and the family is trying to decide if they can get back a little faster. I think some of those reasons we see referrals come sooner than that timeline. But again, I think your pediatrician is a great place to start, and they're just like any other problem or injury, they're very comfortable at knowing what they can handle and what they need to refer on for a subspecialist to help them with.
We've got some viewers asking questions about long-term effects of concussions. Can you tell us more on your thoughts on that?
Yeah, so with long-term effects, I think the biggest thing is we don't know. There are concerns out there, but there are probably more concerns than there are answers at this point. More questions than there are answers. And one of the concepts that has been discussed is what's known as CTE. That stands for chronic traumatic encephalopathy, and that is the sort of the long-term damage and that you're seeing described and talked about in former NFL football players and hockey players, where they do the biopsies on the brain and are seeing changes in the brain there that they think may be the result of these repeated blows of hitting their head over and over and over again. So some dementia, some memory problems, some behavior issues, depression, these types of things have been described to be associated with this CTE. And I think that concern is there, but we don't know who's going to get it, what causes it exactly, how do you prevent it, is everybody at risk of getting that? So again, there are a lot more questions than there are answers, which is why I think a lot of this reflex of concern about should my child play football, because we don't know what's going to happen down the road there. So there's just as much study going in right now trying to understand better the long-term risks and following patients who've had concussions now, following them down the road, see what happens. Because now that we're starting to understand this, it's easy to look back and say, well, that person had a concussion, now they have had problems, but we really need to do these what we call prospective studies and looking at patients now that we're treating the way that we're treating them now, because in the past with concussions, if you were injured, even when I was in training, that wasn't that long ago, I was putting athletes back into a game the same day that they were injured. High school football players, you've got injured, Once you got back to normal, we'd put you back in the same game. That doesn't happen anymore. For at least 10 years, we've not been putting patients back, or athletes back in the game, so we're managing things differently, and we hope that that's going to change the way the outcomes that we're seeing, and maybe reducing the risk of some of these long-term effects is if we're properly managing these. But we don't know that. But that's the hope of what we're working on. We need to study that and see if our new treatments are making a difference.
Good. Let's see, Maggie's asking us how young can athletes get a baseline test? Why don't you tell us what a baseline test is too while you're at it?
So I think she's probably referring to what we call it's a computerized test that tests the brain's function. So when we're looking at a concussion, it is a problem with the way that the brain functions. It's not typically a problem with the brain's structure that we can see. So if we know what the patient's capable of doing in terms of their memory or their reaction time prior to their injury, and if they get hurt, we can then test them again and then compare them to themselves. So your reaction time is half a second before the season. If you get hurt and now it's 1 second, well, there's a reason your reaction time is much slower. We think your brain's not functioning as well. So these are different types of tests that we can use. Here in our center, we use what's called Impact Test. Impact is a brand of this computerized testing, and they have both an adult version for adolescents and adults, and we also have now a pediatric version that goes down to age 5. So 5 to 12, 5 to 11 or 12, we use the pediatric version, and then once they're 12 and up, then we'll use sort of the adult version. But it's helpful for us to have some information, especially if your child's going to be participating in contact sports, whether that be soccer or basketball or football, lacrosse, any of these. If in case they were to get hurt, we can now, rather than having to make a guess about how they might perform on this test, we know what your child's able to do. So I think summertime is a good time to knock those out, or even winter holidays, to come in and just get a baseline test. Hopefully your child won't ever get hurt and we won't ever need to use that information, but if they do, we can at least have something we can look at what's normal for your child.
Very good, very good. We've got one more question, and that's from Chandler, and she's asking, with all the education about concussions, why do you think athletes continue to play after a concussion?
Well, I like that question, and that's something actually an interest of mine. We just presented some of our data looking at a study we did here in San Francisco at the American Academy of Pediatrics national meeting that looked at, we found that almost 40% of our athletes here at our clinic continue to play after their injury, whether that's the same practice or the same game. They continue to play after their injury, and we're not coming out of the game. And so I think that sometimes that's because they don't know that they're injured, and sometimes the symptoms are not that severe, but the majority of the time I think that they are aware that they're injured, but they don't want to let their teammates down, they don't want to let their coaches down, and they just sort of that athlete mentality, I'm going to push through this. And while that may be okay with a bruised ankle that you're probably not going to do much damage to, going back to what we said earlier, that continuing to play while you're injured with a concussion or a potential concussion is the wrong thing to do. It puts you at risk of making that injury a lot worse, but it also puts you at risk of a much longer recovery. And so I think that culturally we as a society need to help athletes continue to understand the importance. This is a brain injury that we're dealing with. This is not just a bruised knee or ankle that you can kind of push through and be tough through, because it's not smart to do that.
Thank you so much for your time today. I think that all of our viewers have had a chance to ask their questions, and you've given some great answers. Thank you for joining us today.
Thank you.